Yes, I do remember. Okay. I will officially call our afternoon board workshop to order. Today's workshop will be a presentation on the Community Health Improvement Plan and the Community Health Assessment. Again, this is a courtesy reminder that this board workshop is recorded and it is live streamed on the Zoom webinar. There will be no votes taken during this workshop. So with that said, let's do an introduction of the folks at the table and in the audience, and then I will just say a few things about prepping us for this or level setting us, and then just handing it over to you all to walk us through. So I'm Mai Chong Zhang, Ramsey County Commissioner for District 6.
Yes, Mike Murphy, Commissioner, District 3.
Amy Karen, St. Paul Ramsey County Public Health Director.
Keisha Gregory Small, Planning Manager, St. Paul Public Health.
Bella Green, Planning Specialist with St. Paul Ramsey County Public Health.
Nadir Abdi, Deputy County Manager, Health and Wellness Service Team.
Lynn Becker, County Manager. Rita Moran, Commissioner, District 4.
Tara Jevon Singh, Commissioner, District 1. Mary Jo McGuire, Commissioner, District 2.
On the side of here.
Clemens Barron, I'm here with Chief. Christy Fox, Planning, County Manager's Office. Abigail D'Amelio, Communication, Community Relations and Anushka Lal, Interim Principal, and Commissioner John. Carissa Dunn, I'm at the Office of the Chief of Staff.
Matt Freeman, Government Relations Specialist. Tom Wilson, Planning Specialist with St. Paul Ramsey County Public Health.
Morgan Sedlchek, Planning Manager with St. Paul Ramsey County Public Health. Megan Maynard, Quality Provisions with Language Education.
Christy Peterson, Program Evaluator in the study.
Perfect. Let's see, did we get everyone? Okay. And then I just heard a question about the St. Paul Ramsey. Yes, I will let Director Amy Karen address that in a bit, but just over the last year, St. Paul Ramsey County Public Health has been leading a community health improvement process. The results of that process are a new community health assessment and community health improvement plan. These are typically 5-year plans that all local health departments are required to develop and implement as a part of state statute. Development of these plans incorporates the voices and recommendations of community members and partners in Ramsey County. And the plans describe how the health department and community will work together to improve the health of the population. So today, public health staff and leadership will be sharing the priorities that came out of the community health improvement process and the initiatives and projects that will be implemented to improve community health. So with that said, I will hand it off to Deputy County Manager Abdi to kick us off and maybe touch on St. Paul.
Thank you, Chair, Commissioners, County Manager Becker. Good afternoon. Thank you for having us today. I will kind of kick us off, but I will let Amy address the Ramsey County. I'll say Ramsey County first.
Yeah, that's right.
St. Paul. But I just wanted to kind of start by saying that the health planning is a core function of public health. It helps us identify community health needs, address disparities, and align resources where they can have the greatest impact. At Ramsey County, City of St. Paul, this work is grounded in community engagement and equity, ensuring our priorities reflect the voices of residents, partners, and staff. Today's workshop provides an overview of the community health improvement process, which begins with the community health assessment and results in community health improvements plan that have been established and shared priorities with measurable goals and coordinated action to improve health outcomes across Ramsey County. The roadmap that you see on the slide illustrates that process and highlights where we are today, the completion of the community health improvement plan. The plan and the infographics summarizing the community engagement and data collection are included in the workshop materials that you have been provided. With that, I will turn it over to Amy and the team, who's gonna walk through the community health improvement process and key findings that inform the plan, and also address the name. Why city of St. Paul is before Ramsey County.
Yeah.
Thank you, Kathy. So, Commissioners, County Manager Becker, with that question, I'm not sure. I'd have to look at our joint powers agreement that we have, but back in the mid-90s, there were two separate health departments. City of St. Paul had their own health department and Ramsey County had theirs. And at that time, they decided to merge. And, we are now St. Paul Ramsey County Public Health. That's the short answer.
Yeah, and just on that, because I've been wondering this all along. Certain cities of a certain size had their own health departments always, or was it always their choice, or did they just automatically have their own health department? Like the other cities in Ramsey County weren't big enough to have their own, and they didn't really want to anyway, but.
Right, I think it was a choice, and then, you'll know, like, you'll see across the state, there will be some counties that are combined, and that's due to a lower population, and so there was, in state statute where you were under a certain population in your county, you had to then join with a conjoining county to make a community health board.
I'm sorry, Manager, one more. In Hennepin County, is Minneapolis its own health department
Yes.
still? So they did not merge.
And Bloomington, Edina, and Richfield also.
All have their own health departments.
They do.
Mhm.
Wow.
Yes.
Um,
I have a
one more question about this.
Yeah.
Hold on, yeah.
I was hoping to be like patience.
Right.
That train is gone now.
Right. I'm just wondering, can we reverse that? I mean, are we under any, I mean, it was in the nineties, is the nineties, we're in
Mhm.
2026
Mhm.
now. You know, and I only say that because I think language words, it just matters,
Yeah.
you know, and we're probably doing all the work, and so I think we need to just
Yeah.
rethink something as simple as that.
And we serve the whole county.
Cause I'm like, are they all working for St. Paul or something here? So I'm just saying, you know.
Mhm.
So,
County manager.
yeah, so commissioners, we can take this as a takeaway. I mean, I have a list of, I don't know, 5 to 7 kind of very dated JPAs that we are working through. It's a big lift for us to redo a JPA. This one is probably due for some look, but we're currently working on the ECC one, which is very critical as well. It has much more of a funding impact, so that's why it went up to the top of the list. We'll put this on the queue of ideas, and as that JPA gets relooked at, you know, that the name can be something we rediscuss and negotiate. So thanks.
Yeah.
Great. Now, let's take it off into the meat.
So the objectives of today's presentation are to provide an overview of public health planning initiatives, outline the community health improvement process, summarize methods and findings from community engagement, and share goals, objectives, and strategies for addressing community health priorities. So the CHA and the CHIP are published once every 5 years. So sharing the plan with you all today is a huge milestone for us. It's only the beginning of what will be 5 years of collaborative work. The reports are a snapshot in time, and I just want to kind of stress that it's a snapshot. But the work and ongoing reporting are intended to be responsive to shifting health needs, according to what community members and partners prioritize as current needs and opportunities. Public health leads the planning process, but the plan is the product of community and partner voices. Implementation and reporting will also be a collaborative effort with partners and subject matter experts across the different systems. And just a note on this too, this plan isn't a summary of everything our public health department does. It's the priorities that the community came up with. And Bella and Hazel explained very well how we get to those priorities and how they got the input from community. And we obviously will focus on these top priorities, but it might not be work that the public health department just carries out itself. It's really community, and some of these things are already going on, and how do we collaborate and be the convener for some of these things? So just wanted to point that out. So we'll go to the next slide. The Community Health Assessment, or CHA, which I just mentioned, and the Community Health Improvement Plan, or CHIP, are just one part of all the great work that public health does. Health planning work happens in our administration division by the planning and performance improvement team that Bella is a part of and Haysha supports. Other divisions of public health include environmental health, clinical services, epidemiology, preparedness and resilience, or EPR, healthy communities, correctional health, family health, and women, infant, and children, or WIC. Together, the work of all our divisions achieve the foundational public health responsibilities, which is the chart there on the right. The Minnesota Department of Health created this framework to outline the fundamental responsibilities that must be present in all communities across the state to efficiently and effectively promote and protect the health of all people. These responsibilities are grounded in community-specific priorities and circled by racial and health equity. The CHA and the CHIP help us address several of these foundational areas and capabilities. Both advance our capabilities in the areas of assessment and surveillance, community partnership development, accountability, and performance management and equity. The CHIP priorities that will be presented later in this presentation will advance work in the area of access to linkage care. Additionally, the CHA and the CHIP align with and advance the priorities of the Ramsey County Strategic Plan. More specifically, the data and findings of these plans offer insights about racial and health equity. The community health improvement process centers community voice and uses shared decision-making to determine community health priorities and solutions. The strategies that will be presented later on focus on how we can better provide culturally congruent and holistic supports that centers residents and their needs.
Director, Karen, Commissioner Jevon Singh just has a question or comment here.
Yeah, so I just wanted to ask, we often talk about how the county administers programs that are often the groundwork for that work is laid out by other governmental entities. When you said this is a foundation that's put together by the state of Minnesota that are the foundational responsibilities of public health departments, I just want to clarify. So does this pretty much dictate the basics of like core county responsible services? And does it also then relay the divisions, or is that a choice of how we organize or something? Just wondering how much of this is prescribed and how much of this is suggestions that then we build off of. If you could clarify that as we go through this, that'd be helpful.
Great question.
Yeah, sure, commissioners. So the divisions on that side, this is how we've decided we are gonna organize ourselves locally. So that's. On the right, the foundational public health responsibilities. This is a national framework that the state of Minnesota adopted.
Okay.
So the Minnesota Department of Health adopted this for our state. And so the expectation is that this would occur in some way, shape, or form across the entire state, no matter what zip code you live in. Everybody has access to this.
So, so this is the general premise, but there isn't like specific, within any one of these, there may be additional prescriptions, but, or not so much.
Well, I mean, it's a framework, and so they want to be able to be flexible enough because there's different priority needs across the state. And so every community health board does this community health assessment, and that helps us garner some of that data. So every 5 years, they all do that across the whole state. So they're leaving some room for flexibility here. This will align with some of the grants that the Department of Health is able to put out to help us do our work. It also falls along our state statute 145A, which is the Public Health Act.
Okay.
So this just helps further define that because there can be kind of some gray areas, as you know, in state statute too. So.
Okay,
Yeah.
so I appreciate that, and I think sometimes it's, I don't want to take too much time or to belabor this, but we are often in a situation of wondering like, what are we mandated to do versus what are we asked to do versus what are we mandated to do, but do it however you choose fit versus no, do it in this very specific way. So I appreciate you laying that out.
Just to follow up on that, thank you, Commissioner Jevon Singh. So, and what are we paid to do? I mean, what are we required to do and what are we given funding for? Which I'm guessing is not a whole lot of this, but maybe we are, or we get grants for it. And
Yeah,
what do you think?
commissioners. That's also a good question is, it's not, there's not equality across the board. I can say that. So a lot of our grants will help us work in these areas, but obviously they don't cover everything. So then we're using levy dollars to do that. So I would say, just off the top of my head, our overall budget for our revenues is somewhere between 20 and 30%. We're getting, state and federal grants to, run the department. Then we have some fee for services and then we have levy dollars. And so it's a combination of those things. So everything but getting back to your question, I can say without even looking at our budget, like everything that's mandated that we need to do, no, it's not fully paid for by the state or federal grants or dollars.
Okay, any other questions, comments about this? Great, thank you.
Okay, next slide. So this slide shows different types of planning work that the public health department does. The plans in red are all internal public health plans, from our 5-year strategic plan that encompasses work of the entire department to individual employee performance plans that detail how each individual staff member's work is contributing to the overall mission and responsibilities of the department and our county. Last year, Public Health began work on updating 3 of our largest plans, which I've mentioned: our strategic plan, our CHA, and CHIP. Last month, we released our new strategic plan, which includes 6 strategic priorities for improving how we do our work. And again, that's our internal plan for our department. So those priorities are to support and develop our workforce, collaborate across program areas and community, use data to guide decisions and ensure accountability, lead with equity and justice, allocate resources to align priorities, and champion public health. The strategic plan was developed in alignment with the data findings of the CHA and the community's priorities in the CHIP. These 3 plans will continue to drive our department-wide strategies for health improvement, both internal and external. All these planning processes are a requirement of all community health boards in Minnesota, which I mentioned, and according to state statute. We are also an accredited health department, which we're very proud of. The plans also adhere to accreditation requirements. So state statute outlines powers and duties of the public health department, including submitting the CHA and CHIP every 5 years, whereas the public health accreditation includes a domain or chapter all about creating, championing, and implementing plans that impact health, including specific criteria for the community health improvement plan. So there's, various things that do guide us. So now I'm going to turn it over to our subject matter experts with us today. Bella's going to present our community health improvement process, starting with our community health assessment for our job.
Thank you, Director Karen, and good afternoon. We'll start with the beginning of our community health improvement process, which is the CHA, or the community health assessments. This is a compilation of data on different health conditions in Ramsey County, and it's really just a big data book. It includes 13 chapters, including over 100 different health topics. And you can see the names of those 13 chapters on the image there on the screen, highlighting how this data covers a wide range of resident experiences and health outcomes, from access to medical care to economic conditions to nutrition and physical health. Given the versatility of the reports, we hope that communities, partners, and leadership can use it as a resource in their work. And a couple of ways that it's currently being used or could be used is to identify health disparities in the county, to provide a foundation for program planning and development, and to share information within or with other agencies, community groups, or leadership about community health. And this entire report is available on our website, Public Health's website. Additionally, we host data walks where information from the report are displayed up on posters. So think of a gallery walk for artwork, but we do that with big posters of local data. And during these data walks, attendees walk around and review the data points, ask questions, and have conversations about the findings. And a little bit of a deeper dive into what the CHA gives context to. In addition to those 13 topics, it shares health trends across time. So how we're doing over time. It compares Ramsey County to regional, state, or national benchmarks. So how are we doing compared to other metro region counties or other jurisdictions? It offers the data in charts and maps. It disaggregates the data by race, ethnicity, geography, gender, or age when that's available in the data set. And it pulls from a wide range of data sources. So it compiles from CDC, from the US Census Bureau, from Minnesota Department of Human Services, Ramsey County data, among many others. And so that's the CHA. Switching gears, well, after the publication of the CHA comes the development of the CHIP, or the Community Health Improvement Plan. What is the CHIP? It's a plan that uplifts the community's current health concerns and outlines objectives and strategies that we will implement to improve health in those areas. And who is that we that's developing and implementing this plan? Well, the CHIP is different from some of the other planning work that we do, such as the internal strategic plan that Director Karen shared, in that the CHIP is developed, implemented, and monitored collaboratively with community. As part of that process, we engage with community members to identify health priority areas, and we'll share about that process. And we're working with community leaders, organizations, and other partner agencies to develop and implement the CHIP now that that's published. As Amy shared, or Director Karen shared, we go through this process every 5 years. Planning itself takes several months, and then the plan is published, which is the report that you all should have received a copy of. And then work is implemented over the next 5 years. So when we say it's a 5-year plan, it's from the date of publication. Public health is, as we shared, required to publish a CHIP to meet accreditation requirements and adhere to state statute. But we see this as more than just checking a box or meeting those requirements. The CHIP gives us an opportunity to ask community members and partners what health topics are most important to them. What are they most concerned about in light of current political, systemic, or environmental factors, as well as the areas they'd like to see the county improve or advance. We capture all of that input, and then we have the opportunity to develop strategies and take action on those areas of concern. This isn't a process that's unique to Ramsey County. Health departments and community health boards across the country go through this process, though their timelines and their methods can vary. We're following a national model called MAP with 2 Ps, which stands for Mobilizing for Action Through Planning and Partnership to structure our process. And there's 3 main phases to the MAP framework, and they're outlined in that graphic there. But stage 1, or phase 1, is largely about building infrastructure for the planning process. Stage 2, or phase 2, involves robust data collection, both qualitative and quantitative, from community members, partners, subject matter experts, and pulling in the data sources of the CHA. And the 3rd phase is to actually build out the CHIP and the mechanisms for monitoring and evaluating that work. So Haysha's going to share a little bit more about the community engagement that we did to fulfill some of the work we did for phase 2 of that process.
Okay, so from September to October 2025, Public Health coordinated community engagement, including a survey and community conversations to hear from community about the health topics that were most important to them. The Community Concern Survey was a tool we adopted from the Minnesota Department of Health's Healthy Minnesota Partnership Survey. The survey was available in 4 languages: English, Spanish, Somali, and Hmong. Language line was provided for those needing it translated in other languages. Promotion of the survey was done by Ramsey County Communications and the advertising agency Meter. The survey asked community members to select the top 3 health topics most important to them from the list, and then share their top concerns and solutions they'd like to see related to those health topics. Community members could scan a QR code and complete the survey on their own at any time between September 3rd and October 27th. Additionally, public health staff spent over 65 hours administering surveys in person at 10 locations around the county. Community members were provided with a $10 gift card for completing the survey in person. In total, there were 656 respondents on the survey. Community was elated to participate in the survey. They couldn't believe that we actually wanted to know what their opinions were. They couldn't believe that in the different places that we are, Rondo Library, Rice Street, rec centers, different, even young people, like, you really want to hear from me? Yes, we do. Absolutely. Public Health also partnered with these 9 organizations above to host conversations with community members. Many on the list are current or prior participants in the Trusted Messenger program, including Face to Face, Raíces Latinas, Haven International, the SONE Foundation, and the Cultural Wellness Center. 825 Arts was recommended by Frogtown Green, a current trusted messenger. St. Paul Ramsey County Public Health's Trusted Messenger Initiative partners with community organizations to expand residents' access to accurate, culturally specific, and linguistically appropriate health information and healthcare services. The first community conversation was held at Rondo Library. It was marketed to the entire county, welcoming all to attend. The remaining conversations were marketed to priority populations and communities that the organizations served. At the first community conversation at Rondo, I had the opportunity to facilitate the conversation with a group of community members about violence and crime. In our group, there was a father and son that sat at our table. The father could not speak English. So when he wanted to share, his young son would interpret for him. And the young son really got into it. He began to translate and write down ideas. They shared concern about violence being a preventable harm, and that a death due to violence was a loss of a future leader. They also shared solutions, such as more youth leadership programs and activities, and more recreational, therapeutic, I remember him saying that, this young man, therapeutic places for young people to go. When it came time to present the group's ideas to the room, the young boy decided to cover for his table. Public Health compensated community members for participating in all these community conversation sessions, providing $30 gift cards per individual. Each conversation posted the same core questions. What health topics are most concerned to you? What could you do? What could help address them? Each conversation was formatted a little bit differently based on the organization's recommendations. Public Health offered coordination and facilitation support, but let the organizations, as the leaders and trusted voices of their communities, decide on the design and flow of the event. Some were sit-down conversations. Others involved getting up and doing a dot voting exercise. Public Health staff attended all the conversations to take notes and distribute gift cards. Most were held in English, but we also received results in Oromo and Spanish that our partners provided translations for. To better support the organizations hosting these conversations, Public Health procured community engagement funding to offset the cost of hosting the events. Event budgets range from $800 to $1,600 that could go towards venue reservation, cultural food and catering, purchasing supplies, providing childcare, helping with transportation to the event, and or compensation to staff. In total, 341 community members attended these community conversations. We recognize, while extensive, this list doesn't represent the entire county or community. The survey utilized a convenience sample, meaning respondents include individuals readily available. So those who can access the survey are willing to participate. Additionally, demographic information was optional on the survey. So race, age, gender, location is not known for all respondents. With community conversation, no identifying information was collected. So demographics are captured at priority population or community group level. Instead, we use the data sampling approach to be inclusive of more community voices. We cannot use the results to do statistical analysis. but it did allow us to capture feedback from a broader range of individuals we may not have otherwise heard from.
Commissioner Jevonsee?
Yes.
Yes, I'm just wondering, were any of these locations outside of St. Paul?
Yes, so we had the Maplewood Library, which is outside of St. Paul. Also, did we leave Maplewood? I remember Rice Street. Well, that's St. Paul. Some of the other locations beside.
Yeah, so, you guys keep thinking. I think when we were doing our prep, I acknowledged that we need to really ensure that at least leveraging all our Ramsey County libraries throughout the whole system is at kind of the baseline for a future engagement. And then if we're able to connect in with other, for example, partners in the Suburban Family Collaborative or other things, we should. But at bare minimum, we should be leveraging all our suburban libraries, Moundsview, North St. Paul, as a touch point for the future surveys. So we did have that conversation
Excellent.
as staff.
Yeah, I have that too, is and I know that we as a county are re-examining how we leverage the partnerships and how we show up in a collaborative, so I don't want to continue to bring up that theme, but that seemed like an obvious place here to be able to reach out to people throughout the county and their needs. Would be to use our collaboratives as well and the organizations, at least to push out a survey like this, especially if it's digital, and then our libraries would be great too. I think that, and the reason why I bring that up isn't a suburban St. Paul issue. It's more along the lines of reflecting the shifting demographics across our entire county and the specific and unique needs of folks who aren't next to services, as there's a lot of service deserts in our greater suburban area. I think of emerging needs in our Moundsview community and other things like that, and they may have a different response to the survey, even if they're from the same cultural group.
Thank you. The picture on the slide from two of our community conversations up there, the top includes Sahabia, a health educator with public health. She's posing with a heart in front of the results of a dot voting activity that we did with the Oromo community of Minnesota. Sahabia helped coordinate the event and was the interpreter to the families who came and participated. She was so proud of the turnout and wanted a photo of the results because it showcased the voices of her community, and that these stickers represent the ideas shared by immigrant families, from children all the way up to one recently immigrated senior. The far right is a photo of the results from a conversation hosted at Haven International, representing the priorities of African immigrant community members and youth who attended the event. At the promotion, all the promotion methods used were Ramsey County website, Gov delivery, 4,400 email contacts, newsletters, social media in 4 languages, Facebook, formerly known Twitter, Snapchat, and Hmong TV channel. A full list of the in-person surveying locations were Environmental Center, Frogtown Community Center, Maplewood Library, Public Health, formerly at 555 Cedar, Ramsey County Government Center, Rice Street Library, Rondo Library, and WIC clinics, Suburban, Rice Street, Midway. So the number of surveys completed in person, 179. Numbers of surveys completed online, 477.
Right. And as Haysha shared, the slide showed the priority population groups. If you're curious about of the demographic information that we did collect of those who responded and provided that, that's at the end in the appendices for the survey. But that really brings us into the results of our engagement, what came out of that process, those conversations that we had in the fall, which are the CHIP priorities for Ramsey County. So the ones that you're seeing on the screen there, meaning that these are the areas where public health will work collaboratively with partners and community leaders to develop and implement strategies. When we promote these as the community health priorities, it isn't to say that work is going to stop happening to address other health needs, but that there will be an increased coordination and partnership for these areas in order for us to be responsive to the health topics that Ramsey County community members identified as most concerning to them. And then public health would serve the role as a convener in that process. So how did we pick these four? Well, we didn't, public health didn't. We worked with community members and leaders to determine them. With the survey and the conversations in the fall, we asked community about 19 different health topics. So we started with 19. From that list, community members picked the topics that were most important to them. As Haysha explained, that gave us a list of the top 10 areas community members were most concerned about. From there, we used a multi-step prioritization process that pulls from that MAP framework that we're using to narrow down our list even further. First, we assessed the potential benefits or harms of either selecting or not selecting each topic area. And then we worked on rating the feasibility and impact of each and mapping that out. Ultimately, it was the county's Community Health Services Advisory Committee, or SHAC, who decided on the priorities for the CHIP, which are the four that you see on the screen. Oop, and I hit the button on accident. Those four that you see on the screen.
Ms. Green, just a quick question. Has this changed much from the previous one?
Yeah, that's a great question. And I can share, it's actually the next piece I was gonna get to, so I can share and see if it
Oh, okay.
answers your question,
Great.
Chair.
Mhm.
So for a bit of historical context, the last time we engaged community for CHIP work was back in 2018. There is some overlap in the priorities from that CHIP cycle till now. Healthy eating, active living, access to healthcare services, housing stability, and mental health and well-being were priorities then, just as they are now. What's different though are the areas of focus. So what are the specific concerns that community voiced about these topics and the solutions that they want to see in the county? So when you get down to that strategy level, that's where we start to see some differences. Of course, a lot has happened since 2018, and we can argue a lot has happened even since the fall when we did this engagement. There's been a lot of very significant events. I want to acknowledge the government shutdown in the fall and Operation Metro Surge, just to name two significant events. Both of those impacted our community health improvement process and of course continue to harm our communities, businesses, and families. But the benefit of the CHIP is that it's a living document that can pivot based off of new needs or opportunities. As Director Karen shared, this report is just a snapshot in time. The moment we kind of printed this, it's just a snapshot for this moment. Moving forward, there will be progress reports that speak to accomplishments and priorities over time and reflect any changes needed.
Commissioner Jevonsing.
Yeah, I think you just touched on it. I was concerned about that overly the time that the community engagement was with the government shutdown. And so that was one ramping up of the surge. And so just, you touched on it, but do you feel as if there was much impact on your ability to do this work that needs to kind of be caveated more strongly so we understand the challenges you faced doing this at that time, or was it fine? I'm asking that.
Yeah, that's a great question. Thank you, Commissioner. We did see it come up, I think, especially with the government shutdown, lots of concerns about food access coming up over and over again, loss of SNAP benefits. And so pieces like that we took into consideration. When we spoke with the Community Health Services Advisory Committee, they too raised those concerns. Just sort of they're these basic needs that the community is voicing. So how do we reconcile what they're saying they need right here in this moment? And then forward thinking, this is a 5-year plan. How do we balance it out in thinking about addressing urgent needs and then thinking about greatest potential impact in the next 5 years of the health topics? So,
and that was my other question is, so that the community services health
is
the SHAC.
Yeah, we call it SHAC. Yeah.
I was gonna say, I always forget one of the letters of those. But so there was another group that was overseeing the input that was coming in because, the idea too of perhaps some folks who are more engaged with what's going on, would understand that even though the federal shutdown, hopefully had been temporary, right? But also that HR1 impacts and the changes to eligibility were around the corner. To be able to take the immediate concerns and then understand how they would transfer to ongoing access issues for healthcare and things like that. So I was just wondering how much are you able to let the community engagement and the voices of community who are expressing their real lived experiences of its own, you know, a high value against folks who are seeing what's coming down the path that maybe has not filtered down to those of us who are in community going about our daily tasks and not following, you know, what's happening in Washington. I mean, how do you balance
Yeah.
that in this process?
Yeah, and that was part of the, thank you, Commissioner, part of what we were, I know, for Community Health Services Advisory Committee, we spent several months in conversation looking at and relooking at specifically what were communities saying, not just that they're concerned about mental health and well-being, but what within mental health are they concerned about, what within healthcare access. Really did a deep dive. We did asset mapping, we did a forces of change exercise, we did all of these steps leading up to them making that decision. They didn't take it lightly. They grappled with that too. And how do we decide on behalf of community, even though they are of community, deciding on these priorities. So it's something where they just looked at all of the information we had available, them knowing what you were saying with other things coming down in the near future, and just sort of thinking about in the scope of what a chip does and the impact that it can have, what might be the best direction to go in.
Thank you for that added insight, and thank you to the folks who had to grapple with that work.
Yeah, yeah. All right. So returning to the 4 topics you see on the screen, the very first thing we did after selecting these chip priorities, as I started to share, was to create issue profiles for each topic area. So it was a collage of information. We pulled in data trends from the CHA. We pulled in community insights from our engagements, and we pulled in sample strategies and measures from other health department chips who had the same priority areas. So looking to some best practices. We did an asset mapping exercise with public health staff, leadership, and SHAC. And that asset mapping helped us start a list of all the partners and resources we could think of working on or related to these 4 topic areas. Public health's role in the CHIP process is as a connector and as a convener. So we wanted to make sure we understood who are all the key individuals and organizations working in these spaces, both large and small. And that said, our list is always growing. And we look forward to continuing to engage with community to stay abreast of current opportunities and needs. After we created these issue profiles, we determined what our key actions and next steps will be. So you'll notice that the CHIP priorities are divided into 2 groups on the slide. This is based on the 2 different types of actions that will be taken to respond to each of these health topic areas. So for the 2 on the left, your left, mental health, well-being, and healthcare access, we'll be coordinating team building and action planning. Public health is coordinating with partners and subject matter experts, or we did and will continue to work with them to develop strategies in the CHIP and in future action plans. There are already, of course, so many great programs and partners working on these issues, not to mention dedicated coalitions and collaboratives such as MWAT, or the Mental Health and Wellbeing Action Team, and the Children's Mental Health Collaborative. What we'd like to see is how we can work together to better promote that work, build newer or strengthen existing connections, learn from the expertise of others, and see how we can remove barriers for individuals and families to access care. Now, for the 2 topics on the right, we'll be supporting relationship building and information sharing. These 2 are also areas that community voiced as being very important to their health and well-being. You'll notice healthy living and chronic conditions is listed, as well as basic needs, which includes economic conditions, food access, and housing stability. These findings showcase that the work of the CHIP is not always limited to what's traditionally thought of as work that public health does. Nevertheless, these are the topics that community felt were most important to them and were affecting their ability to be healthy. One community member summarized it nicely. So this comes from our community survey results. They said, healthy living is the foundation for health. If you don't have housing or economic stability, you can't be healthy. It's all connected. And so to be responsive to those concerns, these topics are included in our CHIP priorities and will be included in the ongoing reporting that we're going to be doing. And like with the 2 CHIP priorities on the left, the 2 on the right, there are plenty of groups and organizations already working on healthy living, chronic conditions, and different areas of basic needs. To name a few, there's the Statewide Health Improvement Partnership, or SHIP, Active Living Ramsey County, Heading Home Ramsey County, Housing Stability, Financial Services, Financial Assistance Services, and countless community-based organizations. The key activities for these CHIP priorities will be to coordinate with these established programs, initiatives, and collaboratives to share the findings of our CHA and our community engagement, and to explore how we can be more aware of each other's work, so that in addressing the health needs of the community, we can also be mindful of things like basic needs and vice versa.
Oh, yeah. Commissioner Jevonsing and then Commissioner Moran.
Yeah, this is a question for County Manager Becker as much as anybody else, which is I know that we sit in several different spaces where things like the asset mapping and other kind of conversations, the data that's shared and all of these kinds of things are many different pockets of county work and community work are required to do these types of assessments. And I know that at one time we talked about leveraging, how do we make sure that we're not duplicating, that we're a receptacle, at least, at least initially for our own internal reports that we need to, that we have one repository as best we can, or a library of sorts to draw from appropriately, but then also to be able to borrow and share with our community partners. And I'm just curious, this seems to be a natural place for that work.
Yeah, thank you, Commissioner. We had these conversations when we were doing the workshop prep, and I don't know if it's gonna show up later in slides, but we talked about possibly ideas such as sharing the results of the assessment, like on the learning management system, so that all county employees, regardless of their role, could have access and use some of the information. Maybe hosting actual like lunch and learns or webinars via the county, you know, so other staff could engage public health with a conversation about what they're learning as it applies to their work in the county. So those are some internal things that we could certainly do to broaden out through the organization. I think the other thing more globally is I appreciate, okay, is Kristen here? She was, right? Oh, there she is. So being, you know, our community partnership work like that, that actually should be the way that we share out with a broader listserv potentially of people that might be interested. Like, how do we package this with maybe something that, you know, a link in our government relations. Like, I think we have to think about how we use this information so it can be leveraged by other people. A lot of times people, and I think you're alluding this too, what they need from the county isn't just like financial support. It's like the access to these very strong themes they can put into their grant reports or other things. And so we need to have a real strong sort of share out strategy so that it can be leveraged both internally and across the community. You know, we talked, Amy, I know we talked about her possibly doing like a mini roadshow. We could line up with when I go around to city councils with some of you, like maybe she could be the featured sort of deeper dive one time. Like, you know, we don't, because we got to be cautious about how often we're showing up at those cities, but we can coordinate, right? Whether it's at the city manager meeting or maybe actually city councils. So I think there's a lot of opportunity, and we had a good conversation about that when we were prepping for this workshop.
Yeah.
So is that the kind of things you were looking
That's
for?
exactly
Yeah.
the kind of things I'm looking for. I'm thinking of our organizational partners, our provider partners,
yep.
our other partners. I'm also thinking, as well as our interdepartmentally, just working smarter, not harder. But then I think too, I do appreciate that you had enthusiastic survey participants. I will say, having been part of community who has like done some of this work in other capacities, sometimes they over surveyed and they say, you ask me these questions, I don't know what happens with this data. I don't know how it helps my community. And so the idea of being able to be, if we are more, if this becomes, if this is community data, that it's community data, and it's less extractive and more of a, this belongs to you because it is you, and it's something that is available to your community organizations as they are looking to be responsive in their own way to the needs. So I appreciate the idea. I mean, even if it's the idea of being able to have more than an accessible data library that we can share out, you know, and that means we can be accessing other partners, things like our Wilders and other folks who are doing their own work. Like, how do we make sure that we are being good partners in sharing of data? Especially, and I hate to harken back to this, but I was a little worried, you know, with the idea of some of the databases are going unfunded or being stripped from some of our national databases, some of the NIH and funding and such things. So the idea of access to good quality data is going to become more and more immediately important as the data that has been collected becomes dated or is no longer available. So if we can fill that gap locally, I think that would be a real asset.
Perfect.
Any other questions or comments? Yeah.
So up here, you have like the the most concerning health topics to community. And so on the left side is mental health access to healthcare, and as you see. So what is the difference? Cause I see one is like a full square and one is dots. To me, it looks like less than, but I know it's not. So tell me the difference in how we are utilizing the information up there, and do Ramsey County are more embedded on the left side than the right side, or are the communities more active on just the right side versus the left side? Can you share with me what I'm seeing here?
Yeah, great question, Commissioner. So it's more getting at what response there will be or what actions are being taken. So for the two on the left in the solid box, we formed action teams to develop goals, objectives, and strategies. So it gives sort of a deeper dive into those two issue areas and seeing what strategies we can develop around them. And we'll share a little bit more about those teams and what their process was. And then the two on the right, we'll continue to build partnerships and build relationships and see what work is happening in those spaces.
So that's like community led, community initiatives. Right, and then trying to figure out where Ramsey County fit in with that partnership or collaborations or.
Yeah, so it's opportunities to see, do we have the right people at the table? Do we have built relationships? Can we strengthen those partnerships? But for those initiatives that are already very strong and leading work in those spaces. And so it's more just about what actions we're taking for each of them. But moving forward, all four will continue to be priorities and be in the reporting that we do. It's just a matter of sort of what's the nature of our engagement with partners and community members around it.
Okay.
Thank you. Yeah, great question. All right. So I've shared about a couple of different groups and teams, and this gives a structure to the core individuals involved. It gives an overview of who all is involved in the community health improvement process, how tasks are divvied up, and how community is integrated in as decision makers in the process. So again, we looked to that MAP framework. So the process involves 3 core groups following that framework. The first is a core planning team, where the public health staff supporting this process. So myself and Heisha, and support, some part-time support from some other staff. And then next is the advisory committee, who provides feedback and guidance for major milestones in the process. So the Community Health Services Advisory Committee, or SHAC, serves as the advisory group to the CHIP process. They advise on public health activities, and they're also they've agreed to advise on our CHIP process as well, and they were heavily a part of our planning process. And then third are action teams, who are made up of the community partners, subject matter experts, and individuals with lived experience who will collaborate to develop and implement the CHIP. So we formed these teams back in March to identify priorities and develop objectives for the CHIPs. So the objectives that you see in the plan come out of those conversations. And then partners have been invited to join implementation efforts that are going to be starting later on in the summer. At meetings with staff and partners, we like to highlight the quote that's at the bottom of the screen there. It comes from the Minnesota Department of Health's handbook for local public health planning, because it emphasizes the collaborative nature of this assessment process and how the CHA and the CHIP need to be designed and implemented with community to be done with fidelity. The quote reads that the CHIP is the community's plan for public health, not public health's plan for community. Community health assessments and plans use a bottom-up approach, and that takes time, trust, and flexibility. Our current CHIP outlines needs in the areas of mental health, well-being, connectivity, healthcare coverage, and access to care. Of course, this is at a time of unprecedented funding cuts to public health and healthcare, strains to organizational capacity, and community mistrust and fear. Given all of this, the threats to health and well-being can at times feel more urgent than ever. We say all this to acknowledge that this is the current reality of public health, mental health, and healthcare as we embark on implementing the objectives of our CHIP. But as this quote emphasizes, it isn't up to public health to decide what should happen around community health improvement. The community told us what to prioritize. And it also doesn't fall on public health alone to carry out the work of this plan. Our scope over the next 5 years will be to take action on strategies that will move the needle on the community's health concerns And we're gonna focus on what's attainable given the collective capacity of the organizations and programs in the county who join in on this process. We're part of the planning and we'll continue to be a part of it.
Commissioner Johnson.
When I look at the list of the priorities that we had, a lot of those fall out of public health role. I mean, mental health services that not beyond, education and outreach, or access to healthcare has to do with someone's access to insurance, which or whether or not a clinic is available in their community. So what role do you all, and the same thing with the housing stability, right? The idea of food insecurity, there's pieces there, but the idea of gas prices impacting grocery store costs. I mean, so what role is it? Education? Is it navigation? Is it advocacy? I mean, I can imagine otherwise the scope creep of what a public health department could try to take on could be immense.
Yeah, and that's the nature of the chip, is that public health serves as a convener or a collaborator, but aren't necessarily the subject matter experts, don't necessarily have programs directly meeting those needs. So in the conversations that we had with the action team partners, they're the ones who are doing the work. They're the system partners. And so it's seeing how public health might have a role to play or a piece of it, but really it's just one piece of the overall puzzle that'll contribute to improved systems and functioning.
Well, I'll just say that convening role, I think, is really key for us to grasp, but then also the opportunity to bridge and jump beyond, with the idea of the one Ramsey County, that you all are convening and having this information and seeing this road plan, but knowing that it really truly means engaging across different departments, whether it's workforce or housing or economic development or those kinds of things. But that's very clarifying. Thank you.
One example I can give you too is like our clinical services, for example. We're not giving primary care services. We're in very specific pieces of healthcare access, and we're really filling the gaps out there. I look at it as a safety net for, very specific populations. And so we're not providing all the healthcare services. We're finding the gaps and saying, hey, we gotta work in these areas for specific populations. So that's just one example.
Yeah, and even with that though, I mean, I just want to be really clear, it's within the public health realm within certain things because, we can't be the boy with the finger in the hole in the wall, right? It's just not gonna, I mean, because there's lots of holes being punched in the walls and there's only so much we can absorb. So I guess I like the idea of being able to raise up community voice to say these are a call for us collectively to address these issues, but not presuming that your department somehow now has a mandate that is beyond, operational.
Yeah, so Chair, one thing that it just occurred to me that we didn't talk about when we were preparing is, I wonder if we don't have a conversation after this and think about how to roll out the report as a larger county. Like, I'm thinking we could create the list of, I think about Commissioner Tay not being here right now, but he sits on the regions board. Like, we have just connections, right? Like the collaborative mailing list, some of the providers, like, it's not just a public health thing, but maybe the broader letter could either, come from myself or a commissioner or something that talks about, hey, this is like one piece of a puzzle. As you are community partners, we want to make sure here's a link, you can have access. These are the key themes, but this is how it, can use it as you advance the work of the greater Ramsey County, the big R, not us as an organization, but the work you do. Thank you for all the things you do. I just feel like that would be it's not an elevation of it as a public health document, but elevation of like, this is the work of the county, and maybe if you're open to that, we could talk about how to do that and get names. I even think about Commissioner McGuire, the partners you have on active living, like there's just so many key people that it ultimately is a foundational document that we are very appreciative of the very thoughtful way you've curated the information, but the real power of it is how it's used and accessed by everybody else in the bigger our Ramsey County, so.
Yeah.
And I think it's a really important, I like where you're going with that, because I think it's really important for us when we have these kinds of documents, when we engage community in these kinds of things, to be able to say, and who owns this work? And to say that it is our role to convene and to uplift voice and to set a roadmap for what Ramsey County and as in its entirety has asked for its collective ecosystem to address. And so, it's not that somehow we are doing this. I mean, that's
Right, yeah, that would be.
because because there are times where we're going to have to make very strategic decisions on how we're using county resources. And one of the things that we've been trying to do is how do we leverage the role that we play within the broader ecosystem beyond the things that we put into community. And I think that being careful about how we message these things can be one, set expectations, but meaning when I say set up expectations, I don't mean lower expectations. I mean, set expectations that collectively we have to address. Like, how do we just choose to care for each other?
Commissioner McGuire.
Yeah, thank you, Madam Chair. And I was gonna bring it back to, because I was just waiting for my time to talk about my favorite entity that expands the county. And when I first got elected to the county board, we talked about public health, it's health in all policies. Like you are like the umbrella for everything the county does. And that's how I think about it in active living, which I do co-chair, started in parks and it was a combination of public health and parks, and now it's in public works. But we do community health assessments. I mean, we do all these things too in active living, and it's just trying to, figure out, how do we make sure we're building on each other, and not each doing our own thing. And so, that's what I'm always looking for is, so how, we do have a really, 60 people, 70, maybe 100 on the list, we get 50 to 60 people at a meeting now and on Zoom sometimes. And, a lot of people don't always know, people, oh, what is active living? Yeah. So it is, it's a whole mobility, right? It's a whole, how do people stay healthy in Ramsey County? So, I think it's just coordinating with all of that. And it's one of the things that when I meet with you, Director Karen, I want to talk about is how do we make sure that everything's connected.
Just given time, I want to keep us moving along with the different goals and what that plan is. And then also just, if you don't mind adding it for each one of those goals about where the county has a role, if any.
Yeah. We have, this gives just an overview of who all sat on joined in our action team meetings. And maybe, let's see, just looking at time, maybe let's skip over this. If there's questions about, this is broad categories, of course, but questions about who specifically represented each of these, we'd be happy to share that. And then this gives the structure of the 4 planning sessions that we had with these partners. And maybe, Aisha, if you want to share this one, and then we can jump right into the objectives.
Okay. So action teams were formed and launched in March to discuss mental health, well-being, belonging, and healthcare access in depth. To frame out these issues and understand how different populations are experiencing health disparities. These planning meeting series occurred over 4 meetings from March to June of this year. The resulting insights and recommendations form the basis of the goals, objectives, and strategies of the CHIP. At the kickoff meeting in March, the group took a look at data from our CHA, insights from our survey, and community conversation, plus data from other sources and notes, questions, comments, and connections to their own work. At the May and June planning meetings, partners identified strengths, opportunities, aspirations, and solutions for the problem areas. As part of this process, partners shared their top aspirations for the county in the areas of mental health, well-being, belonging, and healthcare access. These include better system coordination across the county to better provide whole person and wraparound care to residents, community members better understanding and then feeling confident to use the services available to them, Improvements to referral and care coordination to be more reliable and clear. Expanding culturally appropriate and trauma-informed care and making those options more accessible to residents. For staff, ensuring that they feel cared for and adequately educated to be able to meet needs of their clients and patients.
And those aspirations, I think, summarize well the hope of a system-wide or one Ramsey County approach to addressing these priority areas. And what we have on the next couple of slides are what the actual goals and objectives are that came out of that process that Haysha shared. So we have two goals for mental health, well-being, and belonging. The first goal is promote evidence-based mental well-being approaches that nourish mental health and reduce risks for mental health challenges. And then the objectives are over the next 5 years, so by June of 2031, that cultural partners will collaborate to promote cultural approaches for well-being and community-initiated care, that partners across sectors will create and foster community belonging, and that partners across sectors will coordinate efforts to increase positive identity in youth. So to your question, Chair Commissioner Zhang, I think looking at there's sort of traditional providers and care providers in the mental health and well-being space. I think there's also cultural-based providers that don't always have access to the resources as some of those more conventional providers. And so looking at opportunities to uplift their work and to promote it in the objective around community belonging that comes with carving out spaces that are open to communities. There's a lot of interest in things like third spaces. So both having the physical spaces for community to convene, but then also supporting events that bring community together in those spaces. And so there's plenty of that goes on throughout the county, but just continuing to explore opportunities for that. And then that third objective speaks to more targeted interventions for youth. We have won't get into it, but data from the Minnesota Student Survey that's come out and looks at certain indicators for youth that we're going to look to addressing. And so seeing where there's opportunities of existing services for that population or opportunities to fill that need. Yeah.
You think that'll take 3 years? Well, 4. You think so?
Some of it, so for all of these, we did set it at that 5-year timeline. We did give ourselves the full 5 years, but that'll be the next step in the process with implementation. We'll be making action plans, and those will give us more concrete timelines for how long we anticipate things will take and what our target deadline will be for them. So
I just asked because I think what happens is in 4-year time span, people come and go. We start over. Relationship partnerships, solutions, just continually go, we start something, we stop something. And cultural partners will collaborate to promote cultural responsibility to services. It's something that is like hugely important like now.
yeah.
And to wait 4 years for something like that to happen, I think is really, to me, I don't know what you're trying to get to at the end of 4 years, right? But I think things can happen within a 4-year time limit, like in the next year or two. So give yourself like stepping stones of where you want to be. Because I just can't understand from like me what it would look like in 4 years and why it would take 4 years for something to be responded to.
County manager.
Yeah, I was just gonna say, if you can go back to the first goal, I think we should do a little mapping on existing county work. That's sort of how it aligns and where investments are being made. I even think about this morning with, our talk about the ADC, like we realize that, we need to have better approaches to nourish mental health and reduce risks. And that is happening in a very poor county responsible space and place, and why, like Project Bridge was important, why investing in the right staffing at the ADC. I don't want to lose sight of kind of the plan versus like the things that are already where, I kind of always say like our budget, we have to sort of exemplify through that spending the the values and the feedback we're getting from community. And so, those things in our whole budget, as we bring forth, every department has a budget, it's costing the community something, and it's trading off for these types of, outcomes, if that makes sense. So, I'm sure Sophia's doing work in this space, so I just want to make sure we don't lose the plan versus like what we internally are doing and investing in every day. So.
And can I say, these are like evidence-based practices? It doesn't, it's evidence-based already, right? And so if you can do it, you'll get some result from it.
And maybe it's just the call out of partners, and maybe we need, remember the climate equity action plan? And I felt like there was a big thing for certain departments to own certain pieces of the work. And to me, it's like, I appreciate that partners have to do some work, but what is our work here in doing this? If you heard all this from our community, so.
Commissioner Jevonsing and then Commissioner McGuire.
Yeah, I appreciate you pulling out of like, what are some of the work that we're already doing and what do we need to stay committed to? Because community now has very recently, as of last fall, reiterated their concern. I think of like our appropriate response initiative. I think of our like sexual assault and domestic assault responses. I think of the ways that we are embedding different outreach approaches. I mean, all of the different things that we're doing. I think it's important for us to overlay that as we go through. I think maybe I'm just saying the same thing that Ling is saying, but in my mind, as we go through really tough choices through our budgeting and things like that, to say, well, why is it that we're holding this precious, but maybe making some drawbacks here? And when we're listening to community, that if we have three things that seem to be all viable approaches to community health or mental health, and we see that this one was directly, lifted up by our community voice, then that might help guide us in the multitudes of other information data points that we're getting. But I do like, rather than trying to create something new and outside, how do we make sure to preserve and continue to invest in things that we're already doing or could be doing in a more fidelity? That makes sense?
Yes. Could I just say, people lose hope. People keep prolonging and they can't see the outcome or the impact of all of the work that's done. There could be something that you can repeat back to them, right? In partnership with them.
And may I say quickly, as we were doing the surveying, a lot of the places that we went into, like indigenous roots, different places, cultural wellness center, it was almost like a celebration to them, because what they were saying was, what are some strengths that are already happening? And they said, you know what? Come over here to where we're already doing it at IRA roots, where we're doing it at Cultural Wellness Center, different places that are already doing the work and are seeing the progress. And it was wonderful to have those partners come in and talk about their work and actually celebrate them that are, that's happening right now.
Absolutely. Commissioner McGuire, did you have?
I know, Deputy County Mayor. Okay, well, mine is gonna go to a big picture, and I realize it may go to the next slide already, but I'm just gonna, I wanna put this out there and challenge all of us, because from my day one at Ramsey County, we've been wanting to do this, to coordinate all of our own activities, so we all know what each other's doing. And I brought up active living already, because I know active living had to do an ADA plan because they were applying for a grant that needed an ADA plan. And I'm like, Connie, you shouldn't be the one pulling together. I bet there's people in the county that do ADA plans, and now we have somebody who is doing it, but she spent so much time doing an ADA plan, which totally was something, I think, countywide. And I was just at Lauderdale Day in the Park, love Lauderdale, 2,000 people. Okay, we had two tables for Ramsey County, the Ramsey County Social Services, Ramsey County Public Health, St. Paul, Ramsey County Public Health. And then we were giving out our green bin. Their environmental health team was actually giving out our green bin. So they were taking care of that. We were honoring Public Works because we had done Eustis with them. But and of course I was there to be the umbrella, to do this. But I thought, somewhere we could probably coordinate some of these staffing tables, so that all of our staff, thank you, staff, for being as part of our communities. But I felt kind of bad that we had so many people, like maybe some of that could be coordinated. And I know people have their own expertise and they're each promoting their certain programs, and some of them are doing the community health assessment, actually, which we love. But anyway, I just want to encourage us to keep thinking about that, like where can we, put a little bit less strain on our employees where we want to be out in the community, but we could have maybe had, one table and let the environmental health people at Lauderdale do that and, let other people do stuff. But anyway, just an observation and grateful for all the work that everybody's putting into my communities. And let's think about it.
Deputy County Manager, did you have
Sounds good.
anything?
No,
else to
I was
add?
just gonna say very quickly on what you said, Commissioner Moran, in regards to the date. It's kind of a situation where when you have conversations with the community, they're like, we want things to be like 3-5 years pathway so that it could be sustainable. But I think the timeline is just the timeline, but we're not saying it's gonna take 5 years. I think the work is gonna start. But I think we're just giving ourselves that window, because that's some of the feedback we got, is that you come up with these things as a county, and it's like, by next year, we're gonna do this, and you guys are fast tracking all of these things, and you're not really meeting with some of the community members and kind of getting their thoughts. Because a lot of this stuff are things that they have already thought about. They're like, well, we already do some of this stuff. Why don't you come and learn how we do it? And a combination of both. So I think it's just more of a partnership. I don't think the date says a lot. I think there's gonna be probably timelines that are gonna be hit. And some of the things that we are putting forward here, probably by next year or the year after, you'll see some results there.
And the
not-
community needs to see
and
that.
community see that too, because we're working with them very closely.
And if I could distill it down across all these goals and objectives and strategies that we'll share, it sort of follows to what some of you were saying, where it's a matter of being more aware of what's out there, both for partners and organizations and providers and community members. We had members of our action team say, I didn't know you did that, or I'm gonna refer you now to the people I serve. So even within those rooms, they didn't know who all was working in similar spaces. And then a matter of once there's awareness, actually accessing it. And that came up over and over again. There's community members who know that these services are out there, but they're still not accessing them. So to ask that question of why, and trying to address those barriers. And then the piece about integrating cultural congruency within that work. And so I'd say maybe of some themes of what we heard, and I would say to your Commissioner Moran, where the awareness piece is just a matter of the work's already happening. So I think that's something we could start and already did start really within our action team conversations of just connecting folks and
I'm sure
sharing
it is.
what
I
they
know
do.
it is.
Yeah, but it's a great point. That there is work that we can be doing as soon as possible on some of this. And I'll go through this quickly. The second goal for mental health, well-being, and belonging is to increase access to high-quality, culturally affirming mental health services, with the objectives being that cultural partners will collaborate to inform and promote culturally responsive mental health services, and that partners across sectors will coordinate and amplify efforts to support communities most impacted by anxiety, depression, and suicidality. And again, that second objective speaks to what we're seeing in our data about populations who are disproportionately impacted by those mental health and illness needs. And so looking at targeted interventions for those.
Ms. Green, may you also just follow up with us on that about what the data is saying about like certain communities here as well, that helps to inform the objectives and goals?
Yep, absolutely. We can follow up.
Okay.
And I'm gonna go over this one quickly. So what the slide is showing on the left with the solid circle boxes, those are the solutions we heard from community. So it's a summary of what they wanted to see improve or change in the county. And then what's on the right are the strategies that partners and subject matter experts recommended to both achieve these community solutions, but also to progress the objectives of the CHIP. And these are recommended strategies. So this is what came out of the process, but as we go into the next steps of actually building out our action plan, we may pivot some of this work or refine it based off of who's at the table, kind of what we know in that moment, what we're seeing come out of the data, what they're hearing from the community members they serve. And so I'll leave this slide as is for just the sake of time. We have quotes for what built into those solutions from community and what we specifically heard, so this is just a summary of it. And we can provide details for any of the recommended strategies.
Commissioner
Just a
Jefferson.
quick comment, which is that there are other groups, for any of these things, as we talked about, so there are other groups who may be also continually doing these types of works and being the container or convener for this type of activity collectively.
Mhm.
And I guess part of our ability to be a partner versus always being the lead or the house or the owner of the work would be, at what point do we make our commitment to, and we will join the efforts of X, Y, and Z group in community who's already the kind of the lead convener or backbone of this particular initiative? You know, is that ever our strategy, not as a way of relinquishing our work, but just saying, you know, yes,
Yeah.
we will be good partners and somebody who does, this is what they do 24/7, or I'm just curious.
Yeah, that's a great question, Commissioner. I think some of it comes out of what we find by going out. I think that's out there for several of the priorities, healthy living, chronic conditions, and basic needs. We have a statewide health improvement partnership, who that's the kind of bread and butter. Those are their priorities. And so that's an area where they're gonna do their own assessments. They receive separate funding streams and separate guidance from the state. And so stepping back and having that group take the lead on those priorities is an example. But for some of these with mental health and well-being and healthcare access, I think it's seeing who's working in those spaces. Children's Mental Health Collaborative has been a great partner with it as an example. And just seeing where that convener role is less beneficial in the sense of kind of getting out of the way and letting them take the lead on the work.
I'm going to move us along. We've got, just about 5 minutes left.
So the one goal and series of objectives we have for access to healthcare is to expand service delivery and system navigation to improve connections to care. The objectives being that partners across sectors will collaborate to understand and reduce barriers to accessing healthcare for communities most impacted, that healthcare partners will promote culturally appropriate care support and services, and that partners across sectors will increase transportation accessibility to healthcare services. And again, we have a list of solutions from community and recommended strategies from our partners and subject matter experts to address those solutions and align with the objectives that we came up with.
I just want to put a pin in the partners across sectors will increase transportation accessibility to healthcare, as you know, how I see this connecting in with our transit plan is at the brown line, right? Where we're identifying workplaces, we're identifying healthcare or health centers, you know, as a points of connections in our communities.
Yeah. That's a great point, and I think it speaks to sort of the earlier question where this came up from other partners who aren't working in that space, but it's an opportunity to say what's already being done there and then sort of uplift this, but acknowledge the work that others are doing. So that brings us to the present with our CHIP publication, which you should hopefully have a copy of, our green reports, and we're working with communications to make it fully accessible to share on our website soon. What comes next after planning is implementation or putting into action the recommended strategies in order to achieve our objectives. For both priority areas, our partners ask for an opportunity to meet with, learn from, and problem solve with others. So to move that strategy forward, we're launching a community health improvement collaborative, and the kickoff for that will be on August 17th at the Environmental Center. It's also going to be a hybrid meeting. So there's a Teams link available. And we'll go over the community health improvement process. So it'll be a great event to attend for anybody interested in learning more, even if they're not sure if they want to get involved further on. And then ongoing participation would be opportunities to network and to build relationship with others, discuss challenges and work together on solutions, plus knowledge sharing to learn from others working in similar spaces and become more knowledgeable about resources in the county. So that partnership building and awareness building piece of the objectives. And then CHIP implementation also involves ongoing monitoring and reporting of our progress. And so in addition to this report, describes our process and findings, we'll publish subsequent reports that highlight successes, challenges, and priorities over time. Also ongoing will be our engagement with community members and partners. We plan to communicate broadly about this new publication, sharing about our process, as well as ways that others can use the data, community insights, and recommended strategies in their own work, maybe in grant proposals or their own planning efforts, whatever may be most useful. We intend to think through key groups who would benefit from this information. For example, the community groups and organizations we engaged with in the fall, other county departments, the 3 collaboratives, neighborhood organizations, and St. Paul City Council. And for many of these groups, we're already connected with them or have scheduled engagements with them to share about this report. So that brings us to the end. The key points to take away from today's presentation are that public health is coordinating a community health improvement process. This began last year and will continue over the next 5 years to implement the objectives of the CHIP. It's required by state statutes and accreditation, but our primary motivation for going through this process is to engage with community, understand their primary health concerns, and to serve as a coordinator and convener to address those priorities. In addition to the CHIP, Public Health has published a CHA, which is a rich data resource that covers a number of topics on health, well-being, and social determinants of health, such as economic conditions, housing, stability, and food access. And lastly, in August, a collaborative will be launching to implement and track progress on CHIP objectives. We invite county leadership to share the sign-up link with individuals or organizations who would recommend join this group. Okay. And the last bit offers some recommendations for how to use the CHA and the CHIP that we shared today. So to go beyond today's presentation uses for it. So there's a few listed there on the screen. I'm always happy to connect and to share out further about these reports. In conclusion, we are so excited to share about the publication of our CHA and of our CHIP. As Director Karen shared, these reports are both big accomplishments for public health, and they're also just the beginning of what will be an ongoing, iterative, collaborative process. And collaborative action is just that, it's collaborative. Improving outcomes for our communities takes time, intentionality, thoughtful allocation of resources, trust, collaboration, and advocacy for change. These reports, the CHA and the CHIP, are not going to revolutionize how we work to improve healthcare access, mental health, well-being, and belonging. There's plenty of efforts across the county already doing great work in these areas, but we are excited for the CHA and the CHIP to serve as one more avenue by which community can voice what's important to them. Organizations across the county can work together to be more responsive to that in targeted ways, and the county as a whole can be more transparent about health outcomes and needs. Thank you.
I just
Commissioner Jefferson.
knowing it's getting towards the end of the year or end of the month, and many of us will probably want to like send out this kind of information in our newsletters or on our social media. The QR code here sends us to a form that's interested in being part of a health planning team, but it doesn't let you get to this actual event. So I don't know if we need to update that. So
Okay.
before
I'll
if
look
you could
into
send
that
us
and
an
make sure.
updated invitation.
Yep.
That would be great, and then we can help you get the word out.
Absolutely, thank you.
Right. And then just what I heard from this meeting is just about county manager Becker and the team working together about like how to present this information where it makes sense within our network of both community partners, our city partners. And I'm also thinking about like our philanthropy, like similar to the convening that we had. We're just sharing the information that we have been able to gather. And then we'll get an updated information about the event. And am I missing anything else?
We had someone take notes.
Oh,
So
okay.
if there's any other questions that were brought up, we'll definitely.
Yeah, I'd like to make sure we note the internal sharing out of however you guys decide to do that. We don't have to be prescriptive about it, but I think, you know, a broad base of the organization being able to have access to the data and findings would be helpful.
Yeah.
Thank you.
And then the other part was just about which areas are we already?
Yes,
now.
yes.
Great, thank you.
Thank you. Okay, catch on that, yeah.